going to disable the chat, okay? So that way folks accidentally do not post the answers, I guess. All right, so it seems like who does not want me to, if you do not want me to disable, put your hands like a thumbs down for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16. Hold on, because now you got me confused. Now thumbs up if you want me to disable. All right, folks.
Dr. Lopes.
Hi.
I think people should just ignore the chat. I've been coming to this and it doesn't bother me. People send chats and stuff. Just ignore them and focus on what you have to do.
That's exactly what I say, you know, but it seems that a lot of folks get upset because they're playing on the competition that, you know, and people are putting in. So I will disable, okay, sorry.
Yes,
disable it is very distracting.
Yes.
Yeah, so I'll do that. I hate doing that, but seems that the majority of you guys want to do that. So let me just do that for now. Turn on mics. So what I'm going to do also, I'm going to just turn off the mics. So that way, I'll leave the mics on. How about that? In case if you have a question, you can always ask. Okay. All right, so now we're ready, okay? So hopefully we had a good understanding of module 3, diagnosis and treatment, and we are going to compete against each other. So your job is to answer as fast as you can on your phone, and obviously the correct answer as much as possible, right? So let's let the game begin. Good luck, everyone. Don't feel bad if you don't make the podium. It's extremely hard. Every Thursday we meet here. That's it. 1, 2, 3. Good luck. All right, 1 second. All right, good. So yesterday we discussed brain regions in which ADHD is most likely affecting on those that, you know, have ADHD. So hypofunctioning of the prefrontal cortex. If we think about it, it really explains why we give a stimulant, right? So they often lack, to begin with, neurotransmitters involved, serotonin, norepinephrine, and dopamine. But dopamine really gets them going. It helps them with attention, helps them with reward, right? Now, when we talk about the hippocampus, the one thing that you need to be really pay attention to is stress, right? Stress, hippocampus. So that way you don't confuse it with the medulla. Another thing for the hippocampus to remember is memory and learning, right? But it's not really directly to the core of ADHD. So amygdala, think of the angry amygdala, right? It really is processing and regulations of emotions, has a lot to do with ADHD to some extent, but the core feature of it is really is major depressive disorder and anxiety. And normal functioning of the basal ganglia is not normal for ADHD. In fact, is one of the three things that we talked about yesterday. It's usually related to modem, right? Being on the go all the time. So. All right, 10 seconds. Just about. Okay, I have good news and bad news. If you prescribe Prozac to this patient, you are going to lose your license. Okay, that's the bad news. Now, just kidding. I trust that the phone is small and you picked by mistake. Okay, now the question really is about lithium versus olanzapine, right? We discussed this in detail yesterday. And while psychotherapy could be considered not when they are in manic phase, right? So why then perhaps olanzapine is a little bit better of an option compared to lithium, if lithium is the medication of choice for mania, right? We discussed this in detail yesterday. Hopefully you guys remember, and hopefully if you are in my class, you did not pick lithium. Lithium is a great medication, but you need to give it slowly, right? Or you can give it with antipsychotics, but you give it slowly because you have to monitor, right? So lithium's happy house is 0.6 to 1.2. Now, in practice, we use a lot of olanzapine as a potent medication, antipsychotics, that helps to bring the mania down. I really, really like it. Quitapine is my medication of choice. I know a lot of physicians do use olanzapine. I prefer quitapine because I am following clinical guidelines, not just what I think, right? Nothing wrong with doing olanzapine, but my preference from the knowledge that I think I have, I like quitapine. But the test and in practice, a lot of people do use olanzapine, and there is nothing wrong with that. Antipsychotics will help to bring the mania down, and then you can switch to lithium. Okay, definitely do not give a SSRIs for someone that's manic. And while psychotherapy is helpful, not during mania, right? Because otherwise they're not going to listen to anything, right? All right, 2 seconds and go. Perfect. Yes, you want to assess, right? The rule of thumb is always assess first. Now you have to wonder if it was working, what caused the patient to regress, to have those symptoms back. Sometimes it's very appropriate to increase the medication, but before you do anything, you need to ask, why now? What caused it? You've been doing so well. What happened now? As far as, is there any psychosocial stressors in your life that may be contributing to how you feel, right? And once you rule that out, then you definitely want to consider an increase in SSRI, or you could potentially, depending of the dose, add something else on top mildly, right? So the rule of thumb is always do it carefully and slowly, so that way you don't lose your patient and they don't suffer with side effects, okay? All right, next question. All right, 5 seconds. Perfect. Absolutely perfect. Okay, if you're joining in now, if you came late, on the top left-hand side, you have the website to go to, kahoot.it. The code is 5898272. Okay, I'll make sure leave this open if you want to play along once the game is done as well. All right, so tolerance. We also discussed that you need to know withdrawal, abuse, addiction, and tolerance. They all are in the same kind of realm, but tolerance is needing more of the same medication to achieve the same therapeutic effect, right? Kindling, we need to think of kindling as seizures threshold that are often lower in those with alcohol use disorder. Addiction involves really psychological and folks, kindly watch out for your mics, because that way we can leave the mics on, but we need to make sure that everyone's mics is muted unless if you have a question. So when you think of addiction, really can be psychological independence, a dependence on substance, but compulsive use, right? And potency, we gave you 2 examples yesterday of a high potency and low potency medication and what it really means, right? Has nothing to do with this question. In seconds. right, so we're pretty good here, right? In order to assess, to have a good DSM-5 criteria, to meet the criteria for ADHD, it must be in multiple settings, right? Otherwise, it would not meet the criteria. So what else is super important? Remember that ADHD the symptoms must have been present before the age of 12. Why is that important? Because if someone shows up on your office and says, hey, for the past 6 months, I've been feeling that I'm losing everything, losing my key, I being very disorganized, that does not meet the criteria for ADHD, even though all the symptoms could look like ADHD. The symptoms must have been present before age 12. It does not mean it needed to have a diagnosis, right? It's not saying that it needed a formal diagnosis, but it's one of the questions that you ask before you prescribe stimulants in order to make the, meet the criteria for your diagnosis in order for you to provide the treatment. Okay. Ten seconds. Good. So I know you're in my class if you pick dorsolateral, right? Inattention is highly. It's 1 second. All right. So what I will do is I'll mute everyone
last year
because we're not, so we can have a good audio and then we can discuss any questions at the end. Okay. So my apologies for that. I know it's not on purpose, but it's hard, right? So my apologies. I hate doing that, but so that way we can have good audio. Okay, folks. It's not that I'm trying to tune. I want to bring you in, not to leave you hanging. But if we don't have a good audio, then we can't really do a good job here. All right. So now back to what really is important. So I know you're in my class if you pick dorsolateral, right? It's super important because the dorsolateral has to do with inattention. So it kind of explains things because if you have the prefrontal cortex hypofunctioning, where's the dorsolateral? In the prefrontal cortex. Now, when you give stimulants, you fine-tune the dorsolateral and the orbital frontal. So for the love of God, please know dorsolateral, inattention, orbital frontal, impulsivity. Okay, and you need to know the hippocampus. We stress this a lot, right? It has to do with stress. Is what puts the stress. Questions with the hippocampus always about stress response and memory. And the basal ganglia, you know this from Module 1 Scientific Foundations that we discussed the basal ganglia. And in this case here, has to do with modem hyperactivity, right? Triggering, inability to sit still. So hopefully now you kind of see where the brain regions, or at least most of them, when it's related to ADHD and the why behind it, right? Okay, next question. All right, 10 seconds. Okay, so I'm glad that no one's going to give Sarah benzodiazepines, right? But we still got to prescribe a stimulant rather than a SSRIs. SSRIs are for depression. In the scenario, there was nothing that indicates signs of depression, right? Now, if the question had mentioned that Sarah is 3 years old or 4 years old or 5 years old, then you would select amphetamines, right? And we discussed that all other medications, methylphenidate, guanfacine, clonidine, atomoxetine, are all 6 and up. So that kind of helps you. It will help you on your tests, okay? So make sure you are reading the PDF that we provide and you really knowing the detail, because it will be very, very helpful on your tests. All right, 5 seconds, pick your best answer and go. 2, 3, 1. Okay, I can see why a lot of people would pick Strattera, right? Because Strattera is prescribed for those who have ADHD symptoms. But the question was very, very clear that the person has a tic disorder, right? Modem and vocal tic. So for those with modem and vocal tic, you want to select guanfacine or clonidine, because they offer 2 adrenergic medication. Now be careful, because those medications can also drop the blood pressure. So in practice, you want to go very slow, otherwise you just might lose your patient. Right? I'm feeling too dizzy in the morning, too grog. And if it's an elderly, it can fall, right? So you can use the knowledge of guanfacine and clonidine to help you with other adults that have high blood pressure and ADHD. If they are taking a stimulant, you need to know that will increase your sympathetic system, heart rate is going to go up, blood pressure is going to go up. So you can actually add a little bit of clonidine or guanfacine to help decrease some of this adrenergic influence in the body, right? So you do not want to prescribe a stimulant. Oftentimes, tests will say someone came with the ADHD, was prescribed a stimulant, 4 weeks later returned, and they'll present the patient as the best they have ever been. The best. I'm not just saying, went from an F to a straight A in 30 days. Came before, the patient wouldn't pay attention, would lose things, and now is focused and behaving super well. However, a mild tic, a blink tic, no big deal, right? Well, in practice, we can negotiate, but on the test, you do not switch to another stimulant. You do not decrease the medication. Your only action is guanfacine or clonidine. Now, I would say only. Your most likely action is guanfacine or clonidine I highly doubt the test would put both options, but if it does, then guanfacine would be even a better choice. Okay, now why not atomoxetine, right? It is a good medication. It's a non-stimulant, which is approved for ADHD. However, it does also have an increase in norepinephrine levels. No wonder it helps with dopamine, right? And this option is a reasonable choice, but is not the preferred for those with tics disorder. Okay. Right, 20 seconds. Pick your best answer. 3, 2, go. All right. So we can alert you guys a lot in the course that stimulant abuse, it is a huge problem, and we need to watch out for the signs and symptoms that the patient may be presented when they are abusing of the stimulant, right, or ingesting more than what is prescribed. So they may also present with increasing blood pressure, jittery, anxious, restless, and oftentimes is saying, hey, I need more medication, it's not working, right? So these are signs. There is no way to truly know 100% if they're abusing, but if you suspect, you need to do a little bit more investigation. Now, weight gain and increase in appetite is not typically a stimulant. It might be other drugs, but not a stimulant, right? Slurred speech. If some of you guys picked that, we are looking more into alcohol, right? Sedative medications, not necessarily a stimulant. All right, 5 seconds, pick your best answer. All right, perfect. So I think there is very little to talk about. You want to have a structured environment. I think everyone, if you have ADHD or you don't, if you come home and you throw your keys in the kitchen, in a sofa, guess what? In the morning, you're going to be struggling, right? So you got to have a structured routine. And, you know, I struggled with this a little bit once I worked in ICU because, you know, maybe I was a little bit messy, but as I'm coming to the ICU, I would be hyper focused in make sure everything is the way it's supposed to be, because, you know, if I was lacking of attention, I can't do that once I'm working in the ICU. So I really made the effort to make sure everything is ready to go. So cognitive behavior therapy is a great pharmacological intervention for managing ADHD. Now, the preferred would be pharmacological management, which would be stimulants. So cognitive behavior therapy, non-pharmacological intervention, it is helpful. So we'll keep it at that. Next question. All right, 15 seconds. Okay, nearly identical question, right? So why did the answer change? One word, it says the initial. What would you do initially? Psychoeducation, right? So that is a clear, we can think of it as we get a lot of emails as Dr. Lopes, this and that's identical. If you memorize things, it's not going to work well. The question would ask, what is the first thing you should do, right? Which is your initial step, psychoeducation, right? Now, I have to alert you for this because it's a real scenario in psychiatry. We see this pretty much every week, right? So the test is always about the patient, but there is one scenario that is not. Oftentimes, families, when they come in to have the kid evaluated, one of them might say, hey, I think my kid has ADHD, must have it. The other parents often will say, no, I don't believe it. I don't think he does have it. Once you break the news, oftentimes one of the parents will melt down. Your only action in this scenario is not to prescribe a stimulant, is not to provide psychotherapy for the kid, is to provide brief supportive therapy to the parents. Why is this important? Because the scenario completely changed. In the beginning, it was about the patient. Now it's all about the family. Okay? It's probably one of the most realistic scenarios that you will see on the board. Okay? 1 second. Why did someone hacked my camera? Are you guys able to see Margarita, you hacked my presentation. Please stop doing that. All right. Here we go. We're back on. Thank you, everyone. Okay. So remember this scenario that I discussed. It was about the patient, but the family broke down. Make sure you provide brief supportive therapy to the family. So the question asking, what is the most likely diagnosis? Got cut off. All right, 5 seconds, pick your best answer. So it's clear this is a borderline personality disorder. Some people may confuse it with bipolar, right? We talked about this a lot. Don't confuse bipolar with borderline personality disorder. They both may have mood swing, but they are kind of different. The reason why one is a personality, right? The other one, bipolar, is intrinsic, is inside of them in terms of how they act, whether they are manic, or in depressive episode. But the scenario in which describes self-harm behavior, the scenario describe fear of abandonment, is 100% in line with borderline personality disorder. Okay, and it did not really a little bit talks about major depressive disorder, but the core of it was borderline personality disorder. Okay? Tricky question, okay? Tricky question. Very tricky, actually. All right, why was it so tricky? One, I gotta ask you this question. What is the medication of choice for borderline personality disorder, right? Which medication is FDA approved? None, right? So the scenario described borderline personality disorder with depression. So be careful. If depression is in it, you can try Nalamictal. She's taking the first place. The most recommended option is an SSRI, right? So treating the symptoms specific, but there is no FDA approved medication for borderline personality disorder, right? But because it mentioned depression in it, then that would be your best option. I know that a lot of people went for a mood stabilizer. Maybe you thought of it as being bipolar or mood disorder. It can also help with impulsivity and anger, but it would not be the first go-to medication. Okay. OMG. Okay. Should get 100%, huh? Okay, so for those that did not select the right answer, I trust that was a mistake. Maybe you were kind of doing this too fast. The question said, you suspect a personality disorder. there is only one that says personality in it. Even if you just came from nursing school, you had no clue. Sometimes the question may have synonymous in the answers, right? So if you ever stuck and you don't know which answer to go to, that could be a strategy, okay? Now, what I wanted to talk about is the same scenario, exactly the same, but it changed to age of 13. Now it kind of changed the answer. I would not be surprised if you had antisocial personality disorder as one of the answer, and another answer is conduct disorder. So what is the difference? The age, right? Because in order to be personality disorder, to some extent, we talk about being older than 18, right? With those characteristics, we're looking at conduct disorder. Mercy, I'm not sure what is the question there, Mercy. We can discuss that once we finish this one, okay? Okay, perfect. So I'm actually very curious. Mercy, would you be so kind and if you want to, you don't have to, give your thoughts. Let me open the mics real quick because that is an important distinguish conduct disorder and antisocial personality disorder. Do you have like a comment or something that I can maybe possibly help you? If you don't want to unmute your mic, that's totally okay. All right, then let's go ahead and move on. I'll close it again. Just want to make sure that we can, if you have a comment, we can clarify before we actually end the game and we forget about it. If you want to say hello, unmute your mic. Otherwise, we'll keep on going. Let's keep on going then. Okay. Okay, next question. This one was pretty easy, right? You can see how fast the rank changes here, right? Just want to key on the ODD, characterized by patterns of negative, hostile, and defiance behavior towards authorities, often towards the father, the stepfather, stepmom, the teacher, right? But the key thing compared to conduct disorders, they do not harm animals. They actually feel remorse, which conduct disorders do not feel remorse for their act. It's a hard one. Okay. This was a hard question, I think. Right. So avoidance personality disorder. Why I think was kind of tricky because it mentioned social, being uncomfortable in social situations, right? And that can be very leading towards the social anxiety disorder. But in all, this was more characteristics of avoidance personality disorder, right? So I thought it was tricky, but most of you guys got it correct. So we can keep on moving on this one. So just to look at the spotlight, the personality distinction there, that could provide some feedback if you are confused on this question as well. All right, 20 seconds. All right, so this was pretty clear. The narcissistic personality disorder. I think everyone really got this one easy. So that is great. So we can just keep on moving. So one thing that I like to say about narcissistics is that they think they're the best, yet they want all the accolades, all the gratitude, all the fame, but they don't want to do the work, right? And they are very sensitive to someone calling them out, okay? All right. Okay, perfect. So schizoid, as one of one of our participants said during the lecture, avoids, right? I like that one because it's easy to remember. Schizoid avoids. Schizotypal, you need to differentiate schizoid from schizotypal. So schizoid, it kind of avoids others. They're totally fine being alone. They are indifferent to criticism or praise. They just don't want to see anybody. And the question there clearly defined schizoid, right? You guys are killing it. right, 5 seconds. Pick your best answer. Go. All right. So schizotype, on the other hand, is, weird fantasy. Think of them as kind of wants to have friends, but kind of pulls back because he thinks, hey, who wants to hang out with me? I have these odd, eccentric behaviors, right? So it is kind of still a personality disorder, still part of your personality disorder part A, right? The bucket of A, B, and C, but it's a different feeling, right? So this one is kind of like very exotic, to say the least, right? Unusual perception experience. All right, 1 second and go. So I can see why some people thought this could be schizophrenia, but it more so than not, it describes again schizotype, or the weird, eccentric, magical thinking, right? Now, if we look at schizophrenia, they may also have those positive symptoms, hallucination, disorganization, disorganized behaviors, including the negative symptoms, but it is not a personality disorder. Although they may have odd beliefs, these are more characteristics of schizotype. Okay? And we kind of know really well major depressive disorder and generalized anxiety disorder. Okay? One caveat here. On the test, be on the watch out if you are ever thinking, is this generalized anxiety disorder? Oftentimes, I would say more than 95% of the time, they will describe it 6 months or more of being worried, excessive worries, right? Chronic. So be on the watch out. That is very important. That will help you get the question on generalized anxiety disorder. What if they don't? Well, we are in 2026. They are referring to COVID time. That would be another way to say, hey, okay, it has been over 6 months, okay? All right, 5 seconds and go. All right, perfect. So there is not much to talk about here. This is pretty clear. It was paranoid personality disorder. So remember, this is a personality disorder, not so much a Sometimes schizophrenia patients may have paranoia as well, but this is a type of personality, right? A type of personality. So it's very important that you understand all the personality disorders, because lots of them will be on your test. Okay. Wow, you guys are going pretty fast. Right, so we're good here, right? So histrionic is not it. Histrionic is a lot of calling attention to themselves. This is, again, is a personality disorder, one that wants to be everything perfect. Imagine if everything in your life, it was perfect. How much stress would that be in your life to make every single detail perfect? So that is what oops, sorry, the wrong, did I put the wrong rationale? No, okay, so no, I didn't. So imagine if you have every single detail in your life perfect, how much work would that be? That would be a lot of work, right? Every single thing perfect. So that's what that's what distress coming in. If you have to do a paper, oh, I forgot one thing, let me redo the whole paper because it's not perfect. So those with obsessive personality disorder, they may want to turn in the paper late because it's not perfect yet. And that can be very stressful, very stressful. All right, 10 seconds, pick your best answer. 5, 4, 3, 2, 1. So again, this is really describes well dependent personality disorder, right? So I will let you guys read this one because I think was pretty telling, right? Fear of separations from loved one. They kind of need them. They depend on them, right? And then again, very submissive and clinging behaviors, right? While sometimes borderline personality can have those clinging behaviors, this clearly defines what the dependent personality disorder patients may present with. Right? All right, 10 seconds. All right, so perfect. Nearly perfect. So that is the clear definition of autism. So there is not much to talk about. 18 here. Presentation was pretty clear. Avoidance of eye contact, sometimes even indifference to others, but it's not necessarily you're doing on purpose. They are actually under distress in social situations, right? No wonder they create a autism fantasy. It's very important that you know what autism fantasy is, right? They repeat the question. Yeah, it might have been a repeated question. Okay, perfect. Let's keep on moving here because it was about the same thing. All right, 5 seconds. All right, so it was nearly the same scenario, right? So had very similar presentation and kind of made some people pick the wrong answer, maybe because you're trying to answer fast, but it was nearly the same scenario. Sometimes can be confused with the ADHD, but lining up toys, specifics, habits, avoiding social interaction, that really speaks a lot towards autism spectrum disorder, right? All right. So ABA, Applied Behavioral Analysis Therapy, think of autism, right? Now, cognitive behavior therapy can also be used, but it would not be the go-to typically for autism, more so ADHD, right? And definitely not ECT, electroconvulsive therapy. You don't want to send a kid to ECT. You couldn't anyways. It would have been stopped. Somebody would have said, no, we're not doing this, okay? So, and psychoanalytic psychodynamics, right? Fyodor. So definitely, unless it was some traumatic event or something that needs to have psychoanalytics involved, it wouldn't be a good choice either, right? Okay, so that kind of goes hand to hand with the neurotransmitters involved for ADHD, right? DNS, dopamine, norepinephrine, serotonin. So we also talk about a lot in the course when we look at our chart and we put ADHD, autism right in the middle and all the conditions around it. One of them is seizures disorder, right? Up to 25% could be having seizures, but no doubt ADHD and autism, it is very much connected. So what I would ask you is when you start to see your patients, look what else is there other than autism, right? Is that a depression? Is that an anxiety? Most likely ADHD, okay? And if you can think, what does stimulant do to the brain, right? It really, those stimulants help with modulating the release of neurotransmitters in the brain. In this case, dopamine, right? And norepinephrine. All right, so this is kind of like a repeated scenario. I think the first question or second question of today, we said, hey, clonidine, and now guanfacine for those with tic disorder and possibly ADHD, right? So please remember those two medications. They are very, very high yield. And remember, while atomoxetine can also be considered, it would not be the best medication in this scenario. Okay. and no stimulants, please. Perfect. So again, I'm trying to drive the same scenarios or nearly the same scenarios to make sure that we get 100%, maybe by the end of today. But hopefully the more we do it, we can make the mistakes here and not on the test date. Okay. Last question. Okay, so we're getting pretty good. So for borderline personality disorder, the #1 treatment is dialectical behavior therapy. Please remember Marshall Lynham. She had borderline and she created DBT. Okay, so here we go. Who made PMHNP King? Here we go. Just me. She made the podium, or he. I don't know. First place, 7 days. She's testing 7 days. She will pass the board. I'm telling you, Cube and Pixel. So all of you guys are really, heroes for being here, taking the time to study. I know it's not a easy thing sometimes, and sometimes we don't feel like we want to do it, but think of it as your most important test. And if you keep doing it, if you keep doing the question banks, if you keep coming to the classes and learning from your mistakes, there is no doubt you will be passing the board. So we just had one person that failed the first time. I'm not going to say her name. She passed today, so that is always a great pleasure to see. So what I'll do now is I will unmute you. If you have a question, concern, or if you want to discuss anything, we can talk about it. Let's go ahead and do that. Your mics are on, okay? So, yes, hi.
Hi, it's Scholar.
Who?
Scholar.
Oh, Scholar. Yeah. I was just thinking of you. Scholar, I was thinking of you as this game was playing. Can you believe that? OMG. I was like, because I know you've been struggling and like wanting to break your computer and being very I'm telling you the truth, am I not? Like you've been frustrated so many times, and we kind of like did a little bit of therapies right, over emails. And hopefully I'm not saying anything that I shouldn't, but I am just very proud of you. And I think I have Psych's ability. I really think so, because I was thinking of you. I was like, when is she's testing?
did.
So, OMG. So, your
I
day
did.
is your
Yes.
day.
I
Awesome. So, I'm
I
so
did.
proud of you.
Yeah. It was, I can't lie, it was hard.
It's supposed to be. It's a board,
It was,
right?
it was really hard. I can't even sit here and say, oh, You know, the way people come, the questions are kind of, but it is not like what, like the way they say, oh, it's what. No,
No. I mean, we aim to be close, but we can never be the board because see, I'm not writing the test, but trying to be close to the topic. I'm very proud of you. I'm very proud of you. So
the PDFs, if you just saw the PDFs, I think to me the PDFs helped because I had to read over and over and over the PDFs and the videos. And I did a crash course review by myself because I was worried I was not going to get another crash course review till the 25th, and that would be after. So I did my own crash course review with the videos. And then the day that you said you'll have a mini crash course review, oh my God, I prayed for that day. And when you said it was going to happen, I was like, what? And you did it. And yeah, it helped.
It helped, right? So you found the questions to be similar, the topics. So, yes, it was a lot of work to get that 100 questions.
Yes, it helped.
But like everyone that's really taking the test said, OMG, this was like a blessing. They learned from it. There is a learning whether you get it right or wrong. So there is always a learning process. So I'm super proud of you. Congrats.
Thank you.
Yes, so make sure you send me an email too. Okay?
I was so nervous, like literally shaking in the exam room. I had to walk out and go to the reception, and they said, I'm cold. And they're like, you can go to your car. I said, please get my jacket from my car. I don't care. I am cold. So the one person went and got my jacket. I was scared.
Yeah, I know. We walked through few months over emails. I know you're very upset. But what did I say? Go back. You're now ready. Go back to the PDF. Go read it. Go do active recall. And you're like, Dr. Lopes. And then she was sending me an email says, I'm frustrated. And nothing else in the emails. And I'm like, I don't know how else to help you. Like, I'm telling you the secret. It's just like, and then she says, sorry, I'm spilling all up. I am catastrophizing. I'm like,
that was my subject when I emailed you.
All the time. I'm like, I don't know, Scholar, I'm going to drop you. I don't know how else to help you here. But at the end, all our discussions and honest talk, it came to be exactly what you needed, I think. So congrats.
Thank you.
No more catastrophizing, okay?
No more.
That's it. You worked really hard. I'm very proud of you. Congrats.
Thank you.
Yeah. Let me get with those that stick around, please, because the students, those that are testing, may have a question for you. I'm not sure.
Okay.
Let me go ahead and start with Sharini, Miss McGee.
Can you hear me?
Yes, I can. Hi.
How you doing? My question that I had, and it was a repeat with the ADHD. One was to give them the meds, but then the other one was with the parents. Can you tell me? I don't know.
Oh, yes. So what I'm saying is a true scenario in psychiatry, right? So oftentimes what you see is like dad may think the kid have ADHD, mom is in denial. You are going to evaluate once you say, hey, according to the symptoms, most likely the patient presents with ADHD symptoms. That's most likely the diagnosis. The parents break down because mom may not be expecting that. She was sure the kid didn't have ADHD. So then the question may pose to you, which of the following would you be your next action? So it was all about the patient, and now gives option A, give a stimulant. Option B, start psychotherapy. Option C, offer some herb supplements or whatever, but none of these would be helpful. Think about, would you do teaching when the parents or anyone is breaking down? Now, your only action at that time is to provide brief supportive therapy to the parents. Because if they don't listen, nothing else really matters. They are breaking down, they are stressed. So the question completely switches from the patient, and your action is to provide brief supportive therapy to the parents. So, I wouldn't say that's the only type of a question or scenarios that I can think of, but for sure would be the most important scenario, because the test is all about the patients. For all scenarios, it's all about the patients. Even someone with dementia, which is pretty hard on the family, it's always about the patient. But this scenario, it's about the parents. Does it make sense?
Yes. Yeah.
Yes.
Yeah.
Thank you for the question and clarification for sure. Alrighty. The next person is Jazz Tasky. You have to unmute yourself. Okay, you are muted.
Hi, Dr. Lopez.
Hello. Hi.
Okay, so I have a question.
Sure.
We had a patient on Lexapro, and patient was doing pretty well, but they gained so much weight on Lexapro, so they wanted to be changed. We put them on Vibrate, but after Vibrate, they've been having like a very horrifying outburst, like several times a day. So it is like that was something to be like never seen before.
Yes.
It's like the patient called again and again and said that they are crying and they're fearing of death. And
Yes.
so can you please put comment, like tell me like what could be a better way?
Okay, so what is the board question for your scenario? Anybody wants to chime in? What will be the answer? We have a scenario just like that.
Abilify.
No. If someone is stable on Lexapro and gain weight, what do we do?
Educate.
Education.
Diet and exercise.
Yes.
That's it.
And
That's it. So
lifestyle changes.
you work hard to stabilize your patient. So you want to, before you destabilize your patient, put them in another medication like this scenario, offer lifestyle medication modification, right? So maybe working with the parents, and I highly doubt it is the Lexapro. Everyone likes to blame somebody for something, right? Now, I'm not saying that Lexapro could not add few pounds, but if you say that gain excessive weight, it is something else involved. And I don't know exactly for this, your patient, but I tell you this, what I would have done is I would have encouraged the parents to do, the patient, I don't know how old is the patient, is a child or adolescent, I would have encouraged to do lifestyle modification. How many calories is the patient eating a day? Because it's very easy to blame the medication for it. But when in reality, you can be on any medication. If you're eating 4,000 calories a day, the end result is the same, right? So I'm not saying that I'm not taking it away from the condition, but this is what you described as a classic board question. Okay. Thank you for asking that question. It's very important. Now, what was the diagnosis, right? And the worst thing one can do, if the diagnosis was anxiety and you add them on a stimulant, that's not going to help. So you're trying to fix the behavior of overeating, and you're adding stress to it, right? You're making the patient maybe more anxious. I don't know what was the initial diagnosis, but I do not agree with that call of Vyvanse, right? A stimulant, right? Anyways, great comment there. Let's go with Castillo. Castillo?
Yes, hi, this is Veronica. How are you, doctor?
Good. And yourself?
I'm good. Doctor, I had some question that you actually went over yesterday, and it was actually on the test today. For acute mania, for patients with bipolar, how
Sure.
can we use like Cyprexa or like a second line versus a first line like Haldol instead?
Okay, perfect. Perfect. So instead of me answering the question, let's talk about what do you think?
Me, I would
Yeah.
say, I mean, if I want fast, so, I mean, I guess Haldol is a higher chance for
Exactly.
I can't find the word. Help me.
EPS.
Exactly, EPS. So
EPS,
maybe
right?
that's why.
Yeah, it's a cleaner medication. So the reality is that when we think of, I like to think of math. Math makes a lot of sense for me. So when we get first generation antipsychotics and second generation antipsychotics, first generation, it blocks the dopaminergic neurotransmitters at 80% level. And that is important because the second generation blocks at 60% level. So now you have more dopamine and less EPS.
Yeah.
Yeah, acetylcholine, right? You have less of acetylcholine. If you have more dopamine, you have less of acetylcholine. So that would be the reason why not to use first generation. But that's because second generation has the 5H. TA has 5H1A. But think of this way. Does it make it the first generation useless? No, we can still use first generation. Now the question is when? When you have tried at least 2 second generations antipsychotics and didn't work, the patient may be still having positive symptoms. Now you need to bring the big guns. Now be ready for side effects. Be ready to manage those side effects. So it is very useful. It is very useful. Maybe you need to do like a Haldol injection for someone that's trashing around, but it is a very potent medication. So use second generation because second generation has less EPS, but more metabolic syndrome. Okay.
Thank you, doctor.
Yeah. Thank you. Hopefully that was helpful. All right.
Yes,
Next person. Thank you. Bernie?
Yes, Dr. Lopez, thanks for taking my call. I'm just reminding you, I did get your flashcards from last night. I spoke to you this morning. Just don't forget to look into the email for me, please.
Okay, so you sent me an email and you asked me to look at why you're not seeing on your screen, right?
Yeah, it's what I received. It's that board. It's not specifically from your company.
Okay, I will promise you. If you send me an email, I will respond. I am really behind, and I'm trying to catch up those I have sent an email 2-3 days ago. But I will. Okay.
All right. Thank you. Thanks.
Yes. And if you don't hear from me in 3 days, kindly please send me another email. I don't mind that at all.
Will do.
But I should get to it in the next 2 or 3 days. The weekend I usually catch up. Okay.
Will do. Thanks.
All right. Avery, Tara?
Yes, hello, doctor.
Hey there.
Thank you so much for the course. I just wanted to say I really appreciate all the work you put in.
Yeah,
and my question is during the Kahoot game, you said something that I didn't quite understand about autism. You said it is very important for you to know, and then you said
autism fantasy.
Yes, I don't know what that is. Can you explain?
I can, but instead of me explaining, anybody else wants to kind of chime in on this? Because we talked about it yesterday. Nobody? OMG. This is very important, okay? It will be on your
I can try.
Sure.
Because the autistic kids, they really cannot tolerate noise. So when there's a lot of activation around them, they kind of just like go into their own world and to deal with all the activation in the environment.
Okay.
I can add.
Yes, please.
So autism fantasy is what they use to decrease stress.
Perfect. Perfect. So that is perfect. So I give an example in class of my daughter's friend. I'll say Shishi, that is her name, right? And, you know, Shishi's a very special kid. And we invited her to a birthday party. And while she was outside the house playing with the other kids, she was fine. But when it was time to take the picture for the person that was having the birthday party, and everybody, come on, Shishi, come on. And Shishi came, but Shishi was shaking, you know, because she was around of all these adults and all these people that she doesn't know. And as soon as she took the picture, she ran out of the house. And my daughter's like, Daddy, Shishi is not breathing. She was breathing. My daughter's staying, right? You know, basically that is the scenario in some way. So autism fantasy is a way to shield them from the anxiety of the environment. It's like almost making their own world around themselves in order to protect them. So it's like a fantasy. They create a story to release the stress. Okay.
Okay. Thank you so much. I have one more question.
Sure.
I'm in the crash course. I wasn't able to attend Monday night, but you said you were going to post the recording. Do you know when that will be?
I probably just got the recording today, so probably by Monday I'll have it in the crash course review. I'll make sure that it is the first video of the crash course review.
Okay. I test Tuesday.
So I'll definitely have it before then. I'll have it by Sunday. How about that?
Yay, thank you.
Now, have you looked at the 4 documents in the crash course review?
Yes, I am making my own audio recordings. I'm reading them out loud and then listening to them. And so I'm going through all the PDFs and all of the supplemental things. And I've done all the videos.
Sarah, let me ask you. Go ahead. I'm sorry. I'm sorry.
I haven't finished. I took the test at the end of the crash course, and I took the first diagnostic test, but I haven't taken the other 3. I'm trying to get through all of the PDFs before I take them.
Okay, perfect. So do you answer my question? I was going to say, if you're not enrolled in a diagnostic test, I think it's super important because you don't want to test without not knowing where you stand. That is, to me, the definition of craziness. If you are going to take the most important test of your life, you kind of need to know where you stand before you face this test. So if you score more than 80% on all 4 of them the first time, you are in a good spot to pass the board. If you don't, you just need to evaluate. Now, 80% is an arbitrary number. Some of them you may score like a 77. The other one you might score 85. What I'm trying to say is, if you are scoring like low 70s, it's going to be difficult. But if you're scoring above 75, 70 is, the test score 85. As long as you're getting an average around 80, you should be absolutely okay. Right?
Okay. I plan to take the second one tomorrow, and then the probably third one on Saturday, and then the 4th one on Monday.
Okay.
And just space them out like that. The first one I did really, really well on, so it kind of made me feel like I was
so if you've done well,
compensating, but
and if you've done well on the first one, now try to do maybe diagnostic test 3 first, and then you come back to diagnostic test 2, because 1 and 2 they're kind of similar. 3 and 4 they're kind of similar as well. So you would get the better knowledge if you do like 1 and 3 and 2 and 4. So
do 3 before I do 2?
Yeah, I would. Because if you just did 1 now, it's kind of like they're similar in some ways. Okay. Awesome.
Thank you.
Good luck on your test, okay?
Thank you.
All right, you'll be doing well. Email me once you pass, okay? All right, Carl.
Hi, Dr. Lopez.
Hey there, how can I help you?
You're probably tired of my emails. I'm kind of in the same boat with Tara. I am testing next week though, but instead of the crash course video, because I was in it on Monday, I'm waiting for the 600 question bank that you say you're gonna post.
I'm not gonna post. I'm gonna email.
Oh, email. Okay, yeah, because we filled the email spreadsheet.
I know.
Okay.
I'll definitely get that done. That'll be my priority tomorrow morning. Okay, I'll make sure I'll send you the 600 questions so that way you kind of like have a good baseline. But it does not. The most important is the diagnostic test. The 600 questions just to prime you. The diagnostic test is where it's at. Okay.
Okay, I did take 1 and 2, and I was over 80. Speaking of the diagnostic test, I also sent you an email because diagnostic 2.
Yeah.
I saw 4 questions that I got wrong, but in the they were right.
Correct.
Yeah.
So I think once we had like a breakdown of one of the systems that we had, the team, the 5 of us, we spent 30 hours, almost like 2 days in a row, to transfer all these tests. Might have been those 4 questions. I am definitely going to be fixing them tomorrow morning. I'll be looking at those 4 questions. I appreciate you actually sending to me, because if people say, "Oh, Dr. Lopes," I'm like, I will never find over 3,000 questions. Right. There is no way I will ever find it. So be very specific where they are at. I really appreciate that. Thank you so
you're welcome.
much.
I screenshot them and put them in the email. So you know, it's like, oh yeah, so he knows where to go and where to fix. But yeah,
I really appreciate that. Thank you.
You're welcome.
All right, Doris, Lamar. Okay, that wasn't too hard. I was making harder than it is. Hi, how can I help you?
Hi, thank you for what you do.
Yeah.
Quick question. So I tried playing the Kahoot on my phone, but how am I able to get it, download it? I downloaded the Kahoot, but I don't know how.
Okay. So if you downloaded the Kahoot, all you have to do is enter the pin, the game pin.
Okay, so the game pin, the same thing every week? Or?
No, I don't have the pin ahead of time. The pin is created once the game starts. So if you downloaded the Kahoot, you can go in the chat box and get the game pin, which I don't remember what it was. Anybody remembers what the game pin is? Put it in a chat box so she can play it later. Oh yeah, I do remember. 5898 272. So I'll post it here again. So yes, post it here again, and that way anybody wants to play, even if you are like getting this video later, you can play the game. Just go to Kahoot. You gotta find it, right? So you may want to look for MP exam coach, or that way you kind of find it and you enter the pin game. Okay.
All right. Thank you so much.
My pleasure. All right. The next person is Cam, FNP. Hi.
Oh, hi. Good evening.
Good evening.
Colorado. I'm sorry I missed some of our live class because I'm in a conference day, but it was the same question, Doc, about the Kahoot, because I know originally we scan it, right? But I couldn't find it in my phone. I want to join tonight.
Oh.
For it.
Yes.
Yeah, we have. Yes. So Kahoot, just click this.
Yeah, so you gotta find it, right? You gotta go to Kahoot and then you gotta find it. So let me see if I can find it, and that way you guys don't have to look for it. Give me a quick second while I answer other questions. I will post the Kahoot game and then you can just play it. So having the app, it's really cool because after the game you can play it even if you missed it, right?
Oh, I see.
Yeah. If you find it, please post in the app there. But yeah, so
I'm gonna find the app first, but we can already join from here for now.
You can't join because the game is over. But if you find the game.
Oh, I'm sorry. I'm confused with my time. I'm in Colorado. What time did it start, Doc?
Oh, yeah. I don't know what time is in Colorado right now. I think maybe 3 hours.
7:54 p.m.
So you are an hour behind us.
Okay. So I should have logged in at 6 p.m. here.
Yes.
Sorry.
Yeah, it's all good. So it's kind of hard for me to, I'm going to share the Kahoot here, okay? In the chat, if you want to play, you can, I guess. Let me see. I am putting the Kahoot in the chat box. I believe you can play it that way. It's also called, if you ever search for it, you should be able to find it because I made it open for anybody that wants to play. So this one is a specific, let me see. So it is, sorry, Module 3, Diagnosis and Treatment. This one here. Sorry. Module 3, Diagnosis and Treatment. But the link is in a Kahoot. You can click on it. I mean, the link is in the chat box. You can click on it and you'll be able to play it, hopefully. Yeah. Okay.
So I guess I have to download, Dr. Lopes, the Kahoot, and then.
Yeah, you gotta download the Kahoot, find the game, or they may ask what is the pin for the game, and then you can put 5898272.
Okay, I'm doing that. Thank you. I'm downloading and putting the pin. Thank you. Bye-bye.
Yeah, no problem. So no problem at all. So all these games are there. Not everyone's going to be available because I don't post all of them, but recently I've been posting all these games for you guys to play. It's years of work here, man. All right. So anyways, next person, that way we can kind of finish it off. Doreen.
Hi, Dr. Lopes.
Hi, how can I help you?
I'm good. I joined the class and then had to go for vacation and requested you to have it on hold.
Oh, don't worry. I mean, how long are you? How long are you planning to task? I mean, how long was your vacation? I guess.
I left for 5 weeks. I'm back. I came back last night.
That's fine. You have access up to 6 months. So,
it's not on hold.
No, because you don't need to. You're not going to take, like, unless if it's something comes down that is a health issue. No one really should be over 6 months, unless if you join us when you're in school. That is the exception. Guys, that is actually very serious because even though we are very giving and supportive, too much relaxed environment can be harmful, right? What we think, we all love, I'll do it tomorrow because I don't have a deadline, right? So your goal should be to do it in less than 8 weeks, right? Some people do in 3. I think that's rushing. It is possible, but anyone that is over 12 weeks, you are actually in danger because you're not going to remember what you already done. It's like completing the work and only retaining some of it. So what I recommend is focus, have a beginning and an end, focus, get done, and pass. Okay, that's my recommendation, but you are welcome to stay as long as you need to. Okay?
Thank you.
All right. Dion?
Hi, Dr. Lopez. How are you?
Good.
Hey.
How can I help?
Yes, I just so enjoy your course, and I am absolutely taking your advice. I'm going to test within the 8 weeks. Now, I haven't, really completed everything. I will be testing in about 2.5 weeks from now. But my question is, before, maybe you answered already, but before the actual test starts, we have time to do that dump sheet?
Yes, but you got to practice the dump sheet now if you're testing 2 weeks, right? Because the dump sheet is all about, hey, I just want to get this out of my head. If you start practicing 3 days before the test, it's going to be hard. So what I would do is like get your dump sheet in one piece of paper. Don't try to overload everything. Put in the things that you may have problems like Erickson, maybe like PAG, maybe the dopamine pathways, maybe the drugs that cause mania or depression, or maybe inhibitors, inducers, whatever is particular to you.
Yeah.
And then start writing every day. You got to wake up, do a dumping sheet, boom, and then you put it away. And then tomorrow you do it again. Because, because you're going to be nervous. You're not going to remember this before the test.
Yeah.
So when I tested, I think I wrote the dump sheet 30 times, right? I wake up, I do it in 5 minutes, very fast, put it away.
Yes,
and then
that's
next day
it.
I'll do it again, because if you try to do this the week of,
Yeah.
it's not a good strategy.
Really solid advice. Thank you. Now, one more question.
Sure.
Now, let's say I complete everything and I have 3 days just to kill before the exam. What do you suggest, to lessen the anxiety?
So I suggest to watch the video that we'll post in the crash course review, which was the mini crash course review, which was about 4 hours. It wasn't that mini.
You mean the one Monday?
Yes.
Oh,
So
okay. Yes.
I think now you can also go to module 11. That is actually a better advice. I did 8 hours of recordings in the module 11 with one-to-ones with students. So it's kind of relaxed. You can be, washing dishes, eating hamburgers, having a drink, and just listen to what the student's going to say or whatever I ask, right? You can be cleaning the house, doing laundry, and then like, oh, I know the answer. Then it's relaxed. It's not like a presentation, it's a conversation, right? So that would be a good advice. I think since you already watched the mini crash course review, don't spend time there. Go to module 11. It's a one-to-ones. Those that actually watch the module always come back and say, wow, this was so helpful. But a lot of students don't even make it to it, but it is there for you.
Oh, thank you so much.
All right.
Have a good night.
You too. I'll wait for good results. All right. Boomy.
Yes. Good
Hi
evening,
there.
Dr. Lopes. How are
Good
you?
evening. Good. And yourself?
I'm fine, thank you. And thank you for all you do.
Yes. How can I help you?
So I have a couple of questions, and this is my third week joining.
Yes.
So I want to ask about the diagnostic test. So are we supposed to be doing the test like as we complete the module? Like if like right now we are module 3. So is the module 3 test supposed to be done also as long as we complete the lecture, or do we wait for all the modules to be done, then we go back to the test? Because I'm a little bit confused.
Yes, thank you for asking. So first thing is we have the question bank and we have the diagnostic test. They're totally different, right? So once you complete module 3, you complete module 3 question bank. The diagnostic test, think of it as your final. Or better yet, think of it as the real test. You wouldn't necessarily sit down and be like casually take it. What I like to ask, I don't know if a lot of people do that, is prepare to take the diagnostic test as if you are taking the real test, because that would absolutely shows your weakness and your strengths. And you have 4 of them. So you will need to space them out and in between revise your craft, right? Because you wouldn't test today and walk in the test center tomorrow without looking at your notes and revising what you may have missed. So now those that take it casually, they get what they get. But I would highly advise that you take the diagnostic test as close to the real experience as the real test would be.
Oh, thank you for telling me, because I didn't know that. So I thought after the module 1, take the test. And that's what I've been doing. I've done the first one, I've done the second one. But I've been getting like 60 something. So I was like, wait.
Wait a minute. So are you taking the test or are you taking the question bank? Because you're supposed to take the question
Well,
bank.
I think I'm taking the test, the
How many
165
questions?
one.
Yes.
165.
So please stop. You are taking the test. Okay, let me walk you through it. Let me show you the camera here. Let me go through so you stop there. You don't want to take any of that. Don't worry.
Okay,
Don't,
I've done
don't look
1 and 2, so I'm going to stop.
Yes, stop it. You don't want to see those questions until because you're working really hard, but not the
wonder.
right thing. Yes.
Okay.
So 1 second. So let me just show you here. And we also have the crash course review question bank, right? Those are super high yield that you do before your test because it's going to help you on your test. Just give me a second, please. I'm glad you asked that question. Okay, so I have it here set up. Look, this is your test, right? Once you are in, not
We
really
can
yours.
see.
It's
We
coming
can
up.
see.
It's coming up. Give a second.
Okay, yeah.
All right. So remember, there is this hourglass that kind of contracts.
Yes.
And, expand. Here is your crash course review.
Yes.
Okay. So you have 7 days of 65 questions. So where is module 1, 2, and 3? Right here. If you go to module 3, it shows up. Now, remember this must complete comprehensive, meaning that's the basis. That's the basic of what you're going to get in the crash course review. If you don't do this well, you are not going to do well in any of your crash course review or your diagnostic tests, right? So you have 4 diagnostic tests. One is the pre-test. Before you do the diagnostic test, do the crash course review. And after each module, you complete your question bank. So this is 165 questions. This might be 120 or so, and so forth, right? I don't remember, but they're all at least more than 100. So each one of them is a different scenario, different focus exactly on what we learned, or most of it at least. Okay?
So am I able to retake the diagnostic once I'm ready? Close.
Yes, yeah. You can take as many time as you want. Now the problem is that you want to take them not close, but like as if you are taking the real board exam. Because once
that's actually what I did with the module 1, the diagnostic test. I didn't get up. The moment I started, I timed myself for 3.5 hours. So that was what I did. But it was so stressful. So I'm like, oh my God, am I supposed to be doing this for every module?
Yes, it's a lot of
work. Module 2. I didn't
No,
time myself for module 2. I'm like, okay.
Yeah, no. It's glad you asked. This is module 1, and this is module 2. They're all under one module here, which is must complete comprehensive. Okay.
So I can go back once it's maybe 2 weeks to my person to retake
I would hope that you do it now, because think about it, if you go back here in 2 weeks, you are not going to remember what is module 1 and 2. So I would this week, since we are in the crash course week coming up, go back to the PDF and complete these 3. That would be your goal for the next week, because that way what you learned is not entirely gone. Some people do all the lectures and then come back here and they don't remember because.
So are you talking about the diagnostic test or other question bank?
Question bank.
Yes, I've actually been doing the question bank. So what happened is I have a lot of time on my hand. So I literally listening to lectures and doing questions all day.
So are you doing those questions after each one?
Yes, I'm doing the supplements, mental questions. I've done 1, 2, the 3 module 1s. So I've done the module 2. So I have time. So I want to practice as many questions.
Yes, you can. You can do the supplemental, but don't touch the diagnostic test because as you can see, they are stressful. They are stressful, right?
Yes, it is, because I've been hearing people say they score 80 something. So I'm like, wait, I scored maybe my IS so far has been 68%. So I'm like, why? How are they scoring? I didn't know they did them after the whole thing.
Yes. Okay.
I'm glad I asked. Thank you.
Thank you for the question there. Very important. All right. Let's see who else got a question about anything that is in your mind. Vivian, Is that right? Fong? Fong, are you there? You're muted, okay? You have to unmute yourself.
I am. Can you hear
Go
me
ahead.
now?
Yes, I can hear you. Go ahead.
Okay, I want to take the diagnostic test tomorrow because this is the first time. I think before you start, you said we should take a diagnostic test so we see where we are.
Yes.
So move forward. Today's my second day.
Yeah, it's okay, right? So you need to know where you are so that way you have a good perception. Oh, people say, oh, I'm not good. Well, what is that? Is that a 40%? Is that a 50? So it's kind of like giving you a, hey, this is where I'm at, whether you get 90 or 40, to have a realistic goal. Because for some people that are scoring like 40s, they may need 12 weeks, right? And you need to know where you are in order to know where you're going. That's my recommendation. Everything is a recommendation, right? You do whatever you think is right for you. But I'd say that if I'm going to play video game, I better ask my 10 years old what to do because I have no idea. She's been doing that for a while, right? So it's the same concept. I've been doing this for a long time. And that's what I see most success is when you do the pre-diagnostic test, you complete the video, do the video, the modules question bank, and you keep going, take about 8 to 10 weeks. Now, some people do in 2 weeks. Some people actually do in 2 weeks. It works for them, you know, it's just a recommendation.
So when I go on, is there a link? What link do I go for the pre-diagnostic test?
So you receive the link for the question bank and your pre-diagnostic test is, I also added to the question bank, right? But I'll make sure that you also have it in a different location. So if you go to your question bank and you drop down to where the question bank is located, the pre-diagnostic test I added in there. That may have caused some confusion, but I wanted to make it a little bit easier for everybody to find things because there's a lot of content. This is your pre-diagnostic test. Now remember, these modules kind of contract and kind of close away, right? So if I click on it, they are no longer there, right? So you have to click on it to make sure they open for you. Okay.
All right.
Great question. Thank you for asking. All right. So last person, we call it a day, unless if it's something burning question. No. Anuja.
Hi, Dr. Lopez.
Hi.
Hey, Dr. Lopez, I have a question. So if the question, if the question has two options to measure the metabolic syndrome, the one is BMI and the second one is waist to hip ratio, and third one is the lab. Do I choose BMI or waist to hip ratio?
It is extremely difficult to answer that question because we have to look at the question itself, right?
Okay.
So if the question is asking, let me give you 3 different answers. If the question asks, which of the following would you be most concerned about someone taking olanzapine?
But if the question has nothing with the medication, they just ask you to measure the metabolic syndrome, and the answer was a BMI, hip to waist ratio, and there was a lab or something on the bottom.
So most likely the
BMI?
Waist circumference. Yes. Yeah.
Waist to hip ratio.
But I'm shooting at the dark with no idea, right? Because I don't see the question. The questions can be any one of the possible answers that you mentioned because we have to look at the question very, very carefully, okay?
Right. Okay.
All right. Thank you. Arena. I'm sorry. Arena?
Hi, Dr. Lopez.
Hi.
I've been with you for about 2 months. I just wanted to take the opportunity to thank you for everything. I finished the school, but let me tell you that I was kind of lost because I didn't know where to start with. And when I was told about your course and I started the course, I found it so helpful. I feel like I'm ready to take my board. I'm going to go on Saturday. And I finished all the diagnostic tests this past weekend. I have been studying mainly on the weekends because I've been working like full time, but
Oh, yes.
I'm trying to join your courses here, but mainly on the weekends studying. And I hope that I have good news on Saturday. With the diagnosis, I got like 93 in 2 of them and 88 on 2 others. So, and I've been like trying to take your advice about the 80. So the good thing is that all of the tests, I believe that it's like 25 tests completely, like between the all the modules and the supplementary and all of them. But I just wanted to take the opportunity to thank you so much. I know that you have a lot of people following you, and I would recommend you to everybody that I find out because it's so focused. I have found it so helpful. So I hope that I have good news on Saturday. Now I finished working a few minutes ago, and tomorrow I'm gonna take my day just to try to just a last review or something. But I just wanted to thank you.
Yes. So, Irene, thank you so much. It's very encouraging, and you are the definition of a hard-working person, because it's not easy to keep up a job, probably working 12 hours, or 10 hours, and doing 4 days a week, right? That is taxing on the body and on the mind. And even though it is a situation that a lot of people face, you kept at it, and your score really suggests that you should not have a problem. The only advice that I have for you is to, like you said, you believe that you have good knowledge, that you are well prepared. Don't let your anxiety take over. So if you are in the test and you're getting like super anxious, all you have to do is really is 5 times close one nostril and do it very fast. Immediately oxygenate your brain, and you have a sense of relief. Immediately, just try it very fast. Close one nostril, and it kind of gives this rush on your brain, and kind of relax you, calms you down. Don't fear, right? It is stressful, but if I open right now all the statistics that we have, right? We can open the spreadsheet in front of anyone that ever asks. You will see where you stand if that is your score for the first time, and all these people pass. It's not going to be you that is not, right? So just easy down. Maybe tomorrow go for a run, go celebrate before you take your test. Believe that you already pass, and then just come back and then like it was a normal day, because I prepare for it. You're not going there unprepared. That's not going to be a surprise. You got it, straight, so you'll be okay.
Yeah. I've been trying to follow your advices, just taking when I was going to get the test, just straight. I have been able to finish all of them like less than 3 hours, like 2 hours or something. But definitely this is something that I wish I could have known about this before, because since December, I had a lot of things going on, but it was just mainly that I didn't know where to start with. And as soon as another classmate told me, oh, no, I follow Dr. Lopes, and it was great. That same day, I bought the course and I started. But okay, so I will do that, and I hope that I can just email you with good news. Thank you so much.
You will. You already passed the board, I'm telling you. Okay, good luck on your test.
Okay, good night, and thank you so much. Okay.
My pleasure. Hey, folks, thank you for hanging here with me. Next week, it's the crash course review, right? So should you attend? Yes, it does not matter if you're enrolling tonight, right? If you started 2 days ago, the crash course review is 2 days. That's like 3 times as more as anybody else will ever do. But we are going to cover what I think is the most important content, the most high yield content. So don't feel like, I get this question all the time, Dr. Lopes, I just joined now, should I come to the crash course? Yes, come to as many as you can, because if you come to more than one, I really advise that, because it is 20 hours of a class. You're not going to keep everything. So come to as many as you can. Now, I will be sending an email. If you are only enrolled in the crash course review, you don't have the question bank, right? You shouldn't, because it wouldn't be fair. I still give you 600 questions to practice. If you are enrolled in the full course, you can decide either catch up with modules 1 through 5, or you can start doing the most high yield questions, which is the crash course review question bank. Okay, so these are super high yield. I have 100% confidence if you do the crash course review question bank and you really read the rationale, right? That's probably like somebody else that passed today, maybe over 100 questions, 80 questions come right from there. I really select those questions hand-picked. Okay, other than that, thanks for being here with me tonight, and I'll see you doing the crash course review. Very exciting about this day. You guys have a great night. Okay, thank you, everyone.
You do the same. Bye-bye.
Bye-bye. Take care.
Bye-bye.